to perhaps some of the outcomes that will happen tomorrow, but I give it up to Dr. Roche.
All right. Thanks, Peter. Thanks for having me. I'm excited to talk to everybody today about some of my research and then also the impact of the 2016 presidential election, what we saw from student responses, as well as what we might predict from tomorrow and the days after, and how we can use some strategies to better mental health. Today, whoops, slow down. Today specifically what I'm going to be doing is setting up my research program, which basically looks at personality dysfunction, both how you assess personality dysfunction as well as the impact it has on the person's daily life. In doing and answering those questions, I often use an experience sampling methodology, which I'll be describing to you. And then we'll talk about how this research can really do a lot to help us understand the impact of election results and the impact that it has on us as people. So we'll link that back in. I'll talk about how student mental health might be related to this concept of seeing a presidential election. And then we'll finish up perhaps the discussion about what you think and how we might be able to better address that moving forward at the campus here at Penn State Altoona. So we start first with why care about personality disorders? Well, one reason is that a good amount of people have them. Over 10% we estimate are going to have a personality disorder within the community. If you do have a personality disorder, you're at an increased risk for a variety of negative outcomes that you can see identified here, including suicidality. Patients report more difficulties in therapy if they have a personality disorder, which means it's harder to treat them. Therapists know that. There's increased therapist burnout for people who choose to treat personality disorders. You might know a person or two at your work. They might cause some interpersonal conflicts. They might cause some difficulties for you. Maybe they're missing work, causing you to do some more work, and a variety of other things, including healthcare resources, all of which make it a hardship in terms of this population. So what I'm very much interested in is how do we characterize different aspects of personality dysfunction? What we're going to first do is I'm going to show you a videotape example of an example patient. We'll then listen to what he says, and then we'll see if we can code it for the different aspects of narcissism that he probably displays. Come on in.
What is it that brings you here?
Well, I don't think I need any help, that's for sure. It'll take someone very special to understand me.
Well, I'm sure I'll do my best.
No, Doctor, you don't understand. Not even the people in my department understand me. These are designs that are far-reaching, revolutionary. So what if a bunch of old-fashioned business gurus don't see the appeal of my ideas? These toys are going to keep children entertained for the next decade.
I see. Well, I can see that might be true.
I could go into detail about my most recent idea. It's my most brilliant. It's rather technical, but I could put it into layman's terms for you, if it'd help you understand me.
Perhaps it would, but I think the ones you described already have given me a good enough idea for now. Why don't you tell me something about the promotion?
Oh, you mean the non-promotion? The one I deserved.
All right, tell me about that one.
All right. Anyway, you see, I don't even know why I'm here. Everybody hates a visionary, a rebel, so send him off to the nut house. Did you know that Albert Einstein flunked maths when he was a child?
Yes.
Anyway, I was ready for that job. There was lots of buzz around the office. The way they were looking, I felt they were preparing a big surprise for me. The quieter they were, the more sure I was they were keeping the surprise for the big day. Do I really have time to play those disgusting games, those political second-guessing games, trying to figure out where they're at? No, I was working hard, thinking a lot, coming up with new ideas, while they were playing their silly games.
And then you didn't get the job.
That job is me. I ought just to go into business on my own.
Well, why don't you?
I don't know. I'm better off, I'm sure. No one to get in the way of my thinking, interfere with my ideas. I hate interference from anyone. Having to listen to their mediocre, second-rate suggestions. I could make up new games, new toys, and no one would dare to tell me they were too far out, too weird. Just me and my toys and a few loyal employees that I could trust. I could steal them from the company. I know of not a few people who'd be glad to be associated with me, even work for less money.
So what stops you from actually doing something like that?
I don't know.
Is it something you really, really want?
I deserve it.
You feel you've earned it?
It doesn't matter. I deserve it.
So any examples there we see of any of this narcissism criteria met? Any examples of arrogance that you kind of felt exuding from the video as he was talking? Right? Elements of a grandiose sense of self-importance as if his toys are going to change the entire world, right? A sense of entitlement. I deserve it. I should get that promotion. I can't believe it. I have this fantasy of self-importance, so when people aren't speaking, I'm going to fill it in with my own version of, oh, of course, they're just waiting to show me this really big surprise that's going to be really nice, right? So in terms of the aspect of assessing for narcissism, even in a brief interview, you can see a lot of the diagnostic criteria that he could meet. And if he meets 5 out of 9, then we get to call him narcissistic personality disorder criteria. If he's below that, then we say he doesn't have it at all whatsoever. That's the part about assessment. How about the part about impairment? How much fun would it be to work with this dude? Right? You have people in that at work, you kind of know how they feel. They're thinking their stuff is like the most important thing. They're making you feel. A lot of personality dysfunction is about how it makes you feel inside. You can maybe explore your inner reactions to making it feel like he's arrogant, he's coming off the wrong way, he's making your skin crawl, you just want to tell him about how wrong he is, you just maybe feel stupid around him, and there's all these things where we can imagine it's going to lead to work impairment. Here he's thinking about quitting and forming his own company, again, perhaps exploiting the company to take their employees as a way to do that. So a nice case example of a narcissist, which of course the video was designed to do. If you want a more fun example of a narcissist, all you have to do is turn into The Office. Right? Michael Scott? All the credit, none of the blame. He literally goes to lengths of potentially trying to simulate killing himself so that other people care about him and show how much they should miss him when he's gone. He doesn't tolerate well the idea that other people get what he thinks he deserves. He feels special. Only a certain group of people can really judge him. He has these fantasies about being an actor, about being a movie director, yet he hasn't done a lot to actually move any of those things forward. Again, a nice, pretty specific case example of what narcissism might look like or feel like in The Office, and a lot of that show is organized around the office impairments that happen because of Michael Scott's strategies. But then you got other people in the office that probably fit personality disorder themes. Dwight, for instance, right? If we've seen The Office, we know about Dwight. Here he's shown taking a bull tranquilizer at work, and he shares a lot of the interpersonal aversion that you might see with Michael Scott. Having conflicts with coworkers, having some difficulty getting along with others, getting on people's nerves, and yet he doesn't fit into the diagnostic criteria of narcissism, right? Maybe he can exploit others, but he's not that entitled. He's actually pretty deferential to Michael, and so he doesn't really fit narcissism as a personality disorder criteria. In fact, he doesn't really fit any of the personality disorder categories. He's one of those that really are combinations of some, but not really captured in any one of them. Right? And yet we can see some themes of intimacy problems with all of these cases. Right? Problems with getting a realistic sense of self, a realistic identity with all of these cases we can see. And so the existing way to diagnose or describe personality dysfunction is through 10 categorical personality disorder diagnoses. So we saw a couple of examples of narcissism here. The problem with the existing system is that most often, if you get diagnosed with one, you often get diagnosed with 3 or 4. And so it's common to have many different personality disorder diagnoses, which is not a very specific system. We would like a diagnostic system to tell us about one thing, not to include 3 or 4 things. In fact, if you take all of the personality disorder symptoms and you factor analyze them, factor analysis being a technique to tell us how many different dimensions should we have, the answer is 1. They all load on a single factor that talks about personality disorder severity. So perhaps rather than doing these 10 different categories, we should just have a system that says you either have a more severe personality disorder or you don't. Another quite disappointing thing about the existing diagnostic system is that the most frequently endorsed personality disorder when you look in the medical records is personality disorder not otherwise specified or other specified. What this means is that your patient didn't meet enough criteria for any one of these, but he or she met a couple criteria from each of these so that we know it's personality something, but it doesn't just fit any of these boxes. Said differently, the world is full of more Dwights than they are Michaels. And so if we have an existing system with 10 categories that most of the time you get diagnosed with more than one, but the most common one is a combination of all of them, but yet no specific one is actually working, then we know that this diagnostic system is flawed and should probably be replaced. And in fact, we've known that for more than a decade. The alternative model has been proposed, hasn't been accepted yet, but it's coming up in the literature. And it says, why don't we describe personality disorder instead by how severe it is? You either have these core impairments in a higher level, like a level 4, or moderate or none at like a 1 or a 0. Criterion A captures what personality disorders share in common. Trouble with identity, trouble with intimacy, as we saw in the video, and then the example of The Office, all of them share those core impairments. And if we want a way to distinguish the different flavors of personality dysfunction, why not rely on a model that's been developed since the 1930s, that has had thousands of research studies looking at it, that is robust across gender, across race, and across every different culture that's been looked at, which is most of them, including cultures that don't have a good consensual language. So you can still code for these 5 basic traits or dimensions that can distinguish people. So here we note pathological personality traits that could describe the differences among people. We have negative affectivity, which is the idea of how emotionally intense you are. We saw in the video, the narcissist that was portrayed there probably has a higher level of emotional intensity, maybe compared to other people we could look at. Detachment is feeling isolated from others, either by choice or by action that's occurring. It's often a result of the personality pathology that plays itself out. You piss people off and then they don't want to be around you, and then you're resulting feeling detached. Antagonism, we could imagine the guy going to his coworkers and making them feel as if they're always getting into disagreements with them because he just feels that his way is the correct way. We can also imagine from watching The Office a lot of examples of Michael Scott just telling people that he disagrees with them. Even people in power, like people trying to run an event, he feels like he needs to do it better. Certainly Dwight has some of that as well. Disinhibition is the failure to plan ahead, a lack of planfulness, impulsivity. And then finally, psychoticism, at least in the United States, is about aberrant perceptual experiences, feeling somewhat disconnected from reality. In the United States, we include this as a pathological trait. In Europe, they actually don't do that. They put that with the psychotic disorders specifically, and they don't call that a personality problem. Yet in the United States, we recognize it as such. So here's perhaps a more efficient model to describe personality dysfunction. Let's say how severe you are, and let's use these 5 traits that are versions of the 5-factor model that can describe individual differences in people. Of course, the other criteria basically say your personality disorder is taking with you. Think about Michael Scott. He's going to be the same narcissist whether he's at a party or whether he's at a funeral. It still needs to be about him. And therein lies the difficulty with personality dysfunction. You're so rigidly applying these scripts about how you act and treat people that it gets in your way, especially in moments where you're supposed to show a little bit of empathy. So some of the research that I've done since being at Penn State Altoona, first, working with a former mentor of mine, we wrote a chapter about how this idea of criterion A, the core features that all personality disorders share in common, how it's actually pretty consistent with a lot of different psychological theories of dysfunction. I also did a paper with a graduate student who took my dissertation data and looked at the interpersonal features of criterion A, and lo and behold, as you might expect, one of the greatest interpersonal problems that personality disorder patients describe is trouble with intimacy and getting connected. The next paper was published having worked here at Penn State Altoona. We asked participants to self-report their personality dysfunction. We then asked them to write about their life history. And then I had a variety of research assistants code their life history for personality disorder themes, one of which is a co-author on the paper here. And what we basically found is whether self-report or these coding schemes, we could basically reliably detect who's higher and lower on personality dysfunction, and it relates to important things like interpersonal conflict and how they view their mother and different types of psychological defenses that they use. The other branch of research that I do related to this topic is looking at how personality disorder impacts your daily life. We take a look at how criterion A as well as criterion B, again, that core feature, and then the ways that we can describe individual differences, how that stuff plays out in a person's daily life using experiencing sampling methodology, which I'll say a little bit about now. What I'm basically asking participants to do is to tell me about their day for 2 weeks. They log in and complete a nightly survey about what happened to them today, and they do that for 2 weeks. That's, I think, a nice way to get a really experienced near sense of what's going on in their life. Some of the benefits is that you can reduce the imprecisions from retrospective biases. For instance, if I were to ask you over the last 3 weeks how sad you've been, you could guess about that, but it might be a little bit hard. In fact, diagnostically, when we ask about depression, we need at least 2 weeks of sad feelings. We ask people to retrospectively recall, and the research suggests that when you're in a more sad state, you're more likely to recall more negative, sad experiences. Perhaps it would be better to ask people how sad they are every day for 2 weeks. And so this is one of those ways that can do that. It also captures problems as they exist in daily life rather than just the lab. Sometimes when you go into a lab, you act a little different than you might at home. People in the medical profession know this as well in terms of even blood pressure can look different in the lab as opposed to when at home. And so this we can actually capture the stuff that's going on in their daily life. By collecting longitudinal data, we can answer questions related to who is more severe than others. We can also ask when. On what days are things harder for you? And can that be used to develop different types of treatment? Of course, within this methodology, there are problems. So when they're self-reporting, you might be more flawed in doing a self-report. Particularly like, I don't know about you, but if you get into a conflict with your romantic partner and I ask you like immediately after, maybe we don't report exactly accurately what they said to us. Maybe we're a little bit more biased, and then if we had a couple more hours to reflect, maybe we'd say things a little bit more accurately. So of course, there are biases that are baked into the system as well. Nevertheless, I think it's a pretty good way to capture personality dysfunction as it really exists in their daily life. So this type of study, I answer the question of who. It turns out that people who have higher scores on criterion A and criterion B tend to report greater impairments in all of these domains. What was interesting is that criterion A is meant to capture what all personality disorders share in common, so it should be broadly related to all of these things. Criterion B is supposed to capture specific flavors of personality dysfunction and should be more narrow. And in fact, that's what we found. Criterion A is related to all of these things. Criterion B, for instance, negative affectivity, is uniquely related to emotion. Disinhibition was uniquely related to regulation. Detachment was uniquely related to social problems. And all of these things really conceptually make sense. We could also answer questions of when. For instance, when you become more anxious on certain days, how does that impact how you view your goals in life? Turns out that if you don't have any personality problems, then days where you're more anxious does not lead to an increase in self-direction trouble. Just because you're anxious doesn't mean you start to question your life goals. But if you have a higher level of personality dysfunction, on days where you're more anxious, it does disrupt your self-direction, which is, again, what we might expect and shows you some of the different types of questions you can answer. Now, again, to get this type of data, you need to collect data for 14 nights. And so as I was doing this study, the election happened to happen on like night 2. And so this is where we make the turn to talk about the election. Because again, my research is mainly about how do people cope with things in their daily life. And then all of a sudden, in the middle of this research study, we have a big event like the 2016 presidential election. And we can look to see how people actually change in terms of their perspectives and their mental health in relation to this life event. So to do this, we should probably first step back and take a look at some of the election research that exists. There we go. And so as I looked at this research, and I know some students are here from political science, maybe you could fill in some of these gaps. I'm not an election researcher, and yet I've been able to find some of these studies. If something's missing, please let me know. A lot of the questions about answering reactions to the election are done by large representative samples, where you capture different people each day, and then you use that to infer what the typical American might be experiencing, right? So it turns out that the Gallup poll, who measures 500 new people each day, found that in the 2008 presidential election, saying you're in a bad mood rose by about 3%, but then within a week it returned to whatever level it was at before. In the 2016 presidential election, the next day your being in a bad mood rose by 8% and returned within 7 days to an average level. Daily worry, you can look at 50,000 people that were asked daily from November to February. It turns out that during the 2008 election, worry only increased by about a point and stress by about a point. For the 2016 presidential election, worry went up by about 4 points, which is significantly different, and then stress was about the same. Finally, the American Psychological Association conducted a Stress in America study, sampling about 3,000 people in August of 2016, and then 1,000 more in January. They found that stress rose from 4.8 to 5.1 on a 10-point scale, which they made as being a significant difference. I think that's largely, a pretty small difference. And they say that over half of the people described stress being due to the election, and of course had different breakdowns based on political affiliation. Now notice what this research is doing. It's saying that, look, there's a sharp rise in being in a bad mood. But we didn't really measure that, did we? We said the average American who was sampled the day after the election tended to report more negative mood. We didn't actually track that person yesterday to see if there was a change in negative mood. We're inferring that there is a change across the population, and there's some good reasons based on inferences and statistics to be able to do that, and yet we're not really capturing change in the way that we think and in the way that we're describing things here. Right? Also notice that the things that apparently are important happen to be stress and negative emotions. So some other research that looks at repeated measure designs, for instance, bringing a bunch of people for a party in 2008, one room is filled with Democrats, one room is filled with Republicans, then the events of the election happen. You can track whether your candidate lost and any changes in stress. It turned out to be within a couple of hours a change in stress of the party that lost. They also tracked, this other study tracked emotions 3 weeks prior and 2 days after the 2008 election, and it turns out that when the candidate won that you like, you increase positive activated emotions. When your candidate lost, you have increased negative activated emotion. When I say activated, I mean physiologically activated, like stress, anxiety, fear, things like that, as opposed to deactivated, things like sadness and emptiness. Notice that the effect is stronger for younger adults. I think that might be because young adults don't have a lot of experience with elections going in their favor or not going in their favor, right? It's like everything else in life. If you experience it for the first time, it's perhaps more potent. So this research, taking back, it seems that a lot of it is done without tracking pre- and post designs, although some of them do, and that we generally tend to think about stress and negative emotions. The good news is I have all of that data, so we can take a look at it within our study. So the aim is to try to describe changes in student mental health following the 2016 presidential election. The data that I saw looked at the next day effects, and then again that one study that looked at about a week after to see if the results go away, and that's probably a pretty interesting thing we can look at as well. We can identify individual differences in who reacts to these elections more strongly. And again, because my research is on personality and individual differences, I get very interested in those types of questions. And then finally, we'll talk about some interventions, implications on campus based on the specific results that we find. In other words, we're taking an empirical approach to how we might design interventions for the population based on data that we have. And this study was published a couple months ago in the Psychological Reports. Larger study, over 100 people, but I needed participants who completed a survey on the night before, or at least one night before, and one night after the election. Because if I'm saying that one of the unique things of this study is to look at before and after effects, you need at least one data point on either side, otherwise you're not really doing that. Mostly female, mostly Caucasian, mostly what we would call college-aged. Took an intro psych course and voluntarily participated for extra credit, and the IRB approved this research. What I asked them to do is complete a baseline survey, and I'll say a little bit more about that. But then for 14 nights, they would complete a nightly survey. I'd email them each night and say, complete this online survey. If they didn't, I'd email them the next day and say, hey, you forgot, I'll extend the study for you by 1 day, and then they could complete it the next day. And so by doing that, it was pretty successful. On average, students completed 13 records. Over 90% of them completed at least 9 or more. And again, specific to this subsample, at least one on the before and after side of the presidential election. The baseline measure they completed was a measure of pathological personality traits. That was the criterion B thing we talked about earlier. And then they also completed this nightly survey. I'll show you a portion of the items that they completed that we care about. So they were all in a -4 to +4 scale with the 0 point as well. So it's a 9-point scale. They can just press a button to say where it's at. The questions were, did you feel depressed versus happy, empty versus excited, anxious versus calm today, angry versus content, fearful versus safe, and then did today people make you feel marginalized versus empowered? I also asked them, were they effective at problem solving today, agree versus disagree? Were you bothered by people? How much stress did you experience? It's on the same 9-point scale, but I changed the scaling from 0 to 8. How was your sleep from last night? It's 1 to 4 because a published measure uses that scaling, so I just copied what they did. And then I also asked them, today did you experience race, gender, or age discrimination? If they did, they could just check a box that said, yes, I did today. Now, it's important to note that for the purposes of our work, I rescored all of these things so that higher means worse. For instance, this item, +4 means happy, I reverse scored that, so now higher means more sad or depressed. Something like stress, I didn't have to rescore because that's already the higher is the worse level. Now, the analysis that I chose to use was a multi-level regression model. It's like a basic regression model where we look at an outcome, for instance, stress, for every day for each individual. And that's predicted by your overall level of stress throughout the 2 weeks that you're in the study, plus the effect of November 8th, which happens to be the election night, plus the effect of November 9th, which is the day after, plus the linear effect of the days after the election to see if we can capture the slope that people return to their baseline. Note here that here's the coding for that in case people are interested. When everything's 0, it means basically what happened before the election. Then we have one variable for November 8th, for November 9th, and then as you see, it moves linearly for the days after. Importantly, what we get with this type of data structure is 2 things. Number 1, we get a parameter that says this is the average effect for the sample, which means that, for instance, how much stress played into November 8th, let's say it's 0.6 increase. That's true for everybody in the sample. That's one parameter that captures across everybody in the sample. That's the best estimate we can do. But then you can also model individual differences around that. For instance, if 0.6 increase in stress is the sample's average, maybe some people are at a 0.9, maybe some people are at a -0.3, and we can model those individual differences to see if they're important and relevant. So here are the results. I'll just go through them rather quickly. On November 9th, we see an increase in negative activated emotions, like anxiety, anger, and fear. We see it's about a 1-point upsurge on the day following the election. The negative deactivated emotions were not significant, which is in line with the other research that we talked about. Only anxiety went down after that first day. Anger and fear sustained over the course of being in the study, which means that while anxiety is more of a short-lived effect, anger and fear tended to stick with students, which is something that we can use to inform our treatments or our interventions. Stress went up the day of the election, the day after the election, and then slowly went down over time. Sleep, we adjusted that back by 1 day. So what this means is that people had trouble sleeping on the night of the election, but was fine the day after, and then ultimately started getting better in terms of their sleep. Feeling marginalized was more likely to occur. On the day after the election, and then did not go away. So it's more of a sustained effect. And so again, just to recap these, you see the activated emotions like anxiety, anger, and fear all go up higher on November 9th, and then only anxiety goes back down. The other two stay about the same. You see stress goes up, but then goes back down. Sleep goes up and goes down. That, remember, is on a different scale, which is why it looks like a smaller effect. You see that being bothered was not significant statistically, but you can see it does kind of move up there. And then being marginalized against stays pretty consistent. Again, we also asked them, did you feel discriminated against today? Not for the election in particular. Nothing about this reference to the election, keep in mind. The good news is that on campus here, it's a low likelihood event. 2.6 of all interactions were days where they said that they experienced discrimination, right? We'd like the number to be lower, but it's good that it's low to begin with. And yet, the day after the election, they reported 5.5 times more likely to check that box. Now, maybe that means they experienced the election result itself as a discrimination moment, or maybe it was conversations that they had on that next day, but something's telling us that there is an impact. Okay. You can then look at individual differences. Now, this is the same exact model, but I just expanded out. So, for instance, how stressed were you today? Let's look at how stressed on average you were, and then how does personality differences, like if you're higher in negative affectivity, how might that impact your stress level? Again, this is what I do anyway. Like, I always look at this stuff. How does personality impact these life outcomes? But now we're asking things like, on November 9th, remember stress was a significant effect the day after. Does that get stronger with some of these different personality variables? And can that tell us something about how to intervene differently? Or how you might react based on your style of personality? Rather than showing a bunch of numbers, I just summarized this stuff quickly. We have negative emotions for the outcomes. And so, of course, on average, the more you report negative affectivity, the more likely it is to report negative emotions in your daily life. Also, detachment. Detachment is related to if I feel negative about myself, I have a tendency to withdraw, and so those things often are coupled and going together. You see for November 9th, the big story is antagonism. The more you describe yourself as having an antagonistic personality, the more likely it is to feel empty on the day following the election, to feel more anxious, and to feel more fearful. Interestingly, we see the opposite effect for detachment, but I think you have to combine that with this. So they're already feeling more empty generally, and so there maybe isn't a lot of room to move to being more empty, right? If on a -4 to +4 scale, you're already at a 3 out of 4 for feeling empty, there's not too much more room to move there. Similarly for fearfulness. For the sake of time, we'll maybe skip over some of these overall effects. They do what you would expect. For instance, problem solving is harder the more you describe yourself as disinhibited. But again, we see the story for antagonism, that the more antagonistic you are, the more likely it is the day after the election to experience increased stress and increased trouble with problem-solving ability. And then again, you see these effects for detachment as well, which I again think is you're already at a high level of feeling marginalized to begin with, and so, of course, it has to be a little bit less of an intense upsurge. So, what we found. There are a couple of effects that are unique to the 2016 presidential election. One is that you feel increased, or the average participant reported higher levels of anxiety, stress, and sleep quality, but those things went away pretty quickly, right? That downward trajectory afterwards suggests that we don't really need to design interventions for that because they go away on their own. And in fact, counseling centers that might try to focus on stress management and sleep quality as interventions are maybe not addressing some of the more fundamental sustained things that might be problematic. For instance, feeling anger and fear as well as marginalization. Of course, individual differences amplified these reactions. We saw a protective effect for detachment. It's kind of like, if I'm always detached, I can't feel more detached. We can talk about some of the problems with that strategy towards life. But again, nevertheless, it shows a bit of a protective factor there. And for antagonism, if I am more prone to be exploiting others, disagreeing with others, getting into arguments, lo and behold, when something like presidential election occurs, it's more likely to disrupt some more of your daily life, which makes sense. Some limitations before I get to the implications is that, of course, this is a small convenience sample, and the political affiliation was not known because I didn't think we were going to do a political study in the middle of this.